Health outcomes. Changes due to interventions. To bring positive change, patient experiences and health must both improve. Healthcare costs must be lowered, and clinician and staff burnout has to end. But our problems are big. 133 million Americans have at least one chronic disease. 500,000 people are dying every year from hospital errors, injuries, and infection. The shortage of primary care professionals will be as much as 100,000 in just the next 5 years. Big problems require bigger solutions. Positive change needs acceleration. It needs to happen now. But these are not so easy solutions that many don't want to hear, and even few are willing to talk about. How to lead such a change? How to discover, discuss, and disrupt healthcare to make a difference now? This is VITALS, Visionary Health Leadership in Action.
A pleasure to have one of our own here with us today. Her internal medicine residency was completed at University Hospitals Cleveland Medical Center, and her fellowship in allergy and immunology was completed at the National Institutes of Health in Bethesda. Prior to joining us in Cleveland, she was the director of allergy and immunology at Ohio State University. She also serves as chairman of the American Board of Allergy and Immunology and has leadership positions in the College and the Academy of Allergy, and Asthma and Immunology. Her research and clinical interests are in eosinophilic disorders, COVID-19, and health disparities. She's highly recognized and well accomplished and highly rewarded physician, recognized as a top doctor in both Cleveland and Columbus. And she has been recognized through the Castle Connolly Award for Women's Excellence in Leadership in Medicine, and also a Courage to Teach Award from the Ohio State University. Dr. Ogbogu, please join me on the stage. We're looking forward to hearing from you.
Thank you very much. Can everyone hear me today? Okay. All right. Well, thank you very much. I am so pleased to be here with you today and to share a little bit about my journey with you. We're going to talk about how communication and trust can really lead to positive outcomes in healthcare, and talk a lot about this journey through relationship building. So thank you very much for inviting me and allowing me to share my story. And when I was first asked to do this, I really thought this was intriguing. I loved the idea of 17 minutes. 17 minutes is the length of time for the average patient-physician encounter. And for me, as I thought about it, it's sometimes all the time that we have to make a difference in patient care, a difference in teaching, a difference in health and wellness, the journey that you take with the patient. And as I really thought about it, I thought, you know what, we don't even have that full 17 minutes. And I will explain this to you shortly. So first, I will tell you about myself. I was in the shoes of many of the medical students sitting here today. I grew up in Northeast Ohio. I knew that I wanted to go into medicine really early at a young age. I applied to the NEOMED BSMD program from high school and was so elated to get into the program. I knew at that point that I wanted to make a difference, and I was really young and probably naive because I didn't know how I was going to make that difference. And I actually never questioned if I could make that difference. I just assumed that I could. Attending NEOMED was really life-changing for me. I think it really gave me the foundation that I carry forward with me today. It taught me several different traits that I just carry with me and I think have been really helpful. And a lot of that has been how to ask questions, following my curiosity, working hard, showing compassion. And these traits, I think, have really served me well. So with that, I want to talk about just a few, and I think I'm having a little bit of a technical difficulty here. So I want to talk about a few things that were really important to me as we, think through this vitals. Um, as you heard, I've accomplished many things in my career. I've had the privilege of taking care of patients clinically, of serving patients in the public in national leadership positions, and have had the privilege to be able to create new educational and patient care paths. When I thought about what I wanted to share, I really thought about what were the running themes throughout the various aspects of my career and my trajectory that were really helpful for me to get to where I am right now, and that I still find helpful to move forward. And some of these themes were relationship building, listening, being open to learning new things, not being afraid to walk through the next door, or being afraid of change, and not accepting the status quo. So with that, I want to share my journey with you to trying to affect positive change in healthcare through at least 4 of these ideas that I think have been really critical for me, and I think are really generalizable for many of you that are going through your own healthcare journeys. So the first one is relationship building. I think this sounds really basic, but this concept has the potential to direct so many of the interactions in our efforts as clinicians and healthcare leaders, researchers, students. When I think about my own story, I realized that when I was a medical student, even early as a resident, I really didn't have a clear conviction of exactly what I wanted to do or where I wanted to go with my career. And now, we ask our students, our trainees, our faculty, our administrators, we really ask everyone, what is your 5-year plan? What is your 10-year plan? And the reality, if we really think about it, is except in rare situations, really early on, you may not know. You're just figuring it out. You're just being open to new possibilities. You're working hard and hoping that that you'll determine what your plan is going to be. And sometimes the next step is determined by a passion, a vision, an experience. Sometimes our next step is determined by life circumstance. But what I really realized is sometimes that next step is actually determined by the relationships that we create and that we build along the way that show us new possibilities that we may not have thought about. So we all probably remember a really passionate teacher that we had in grade school, in middle school, in high school, and college, someone who truly left an impression on you. For me, that was my 4th grade homeroom teacher, Mrs. Clark, and it was my 10th grade math teacher, Mr. Patty. In these situations, you may not have even liked the subject, but you gravitate towards the passion of the teacher, the enthusiasm, the bond that the teacher creates with the student. And then all of a sudden, a relationship is built and trust is formed. And then you're open to learning new things that you may not have planned to like or expected to like. And this is important because medicine's like this in so many aspects. In medicine, our relationships dictate our future and our effectiveness. And I think that's really important. So I'll repeat that again. In medicine, our relationships dictate our future and our effectiveness. So an example of this is in the clinical realm. A really important part of a clinical visit. So the uptake of any recommendation that you give, the outcome of the visit, the journey to health and wellness really depends on the relationship that you build with the patient, the trust that's built to take that journey together. This is even more critical in the time periods where we are seeing patients whose voices may not have been heard historically and may not have been respected. And then relationship building is also really critical when it comes to building teams. Each one of us may be truly exceptional in our own right, but we don't operate in silos. We have to work together in medicine to be successful. And so building these relationships is actually very important to come to a greater understanding and to have unity for a mission. A lot of my career and my path to leadership came from building relationships. So maybe things I never thought that I was going to do, but building those relationships allowed me to have these opportunities that expanded my potential for career growth, my potential for development, my potential for visibility. And for us, visibility is actually critically important. I've learned that along the way. So being visible is important. Building relationships gives these opportunities. And then once you have opportunity, then there truly is possibility. So when I was a fellow at the National Institutes of Health, I had the opportunity to learn about research. I had the opportunity to learn how to do research, how to conduct it, how to understand it, how to analyze it. And that was really critical for me. And then in my first faculty position at The Ohio State University, when we opened up a new fellowship training program, I had the opportunity to learn how to become an effective teacher. And it was a privilege to learn. And so, I think that with opportunity, you get these experiences and you build these relationships, you cultivate relationships that allow you to open doors that you never had before. And once you build these relationships, there's possibility. I found that people in general, whether they're colleagues or mentors or supervisors or leaders or other stakeholders, they are so important. The relationships are important because they're excited to show you what they do. They're excited to teach you what they do. They're excited to take you down these paths when you're open to building relationships and learning. So this is really important. Building relationships, I think, is not easy. It's something that we all kind of do along the way, but it takes certain skills. Those skills are self-awareness, empathy, emotional intelligence, and active listening to build the relationships. And so as I thought about, well, how do I do this? How am I able to establish these connections? The next important thing I want to share with you is it sounds really simple, but it's listening. This sounds so simple. It sounds so basic, but I actually contend that it's one of the hardest skills to master is listening. It's one of the most important skills that's necessary for success in healthcare. So at the beginning, we mentioned the 17 minutes as the premise for the average length of the patient-physician encounter. But that 17 minutes really is bidirectional. It's not just 17 minutes of me or you speaking to the patient. It's 17 minutes of a full bidirectional relationship. So a lot of that is listening. A good portion's listening. It's absolutely critical to listen. One of the biggest challenges that we have in healthcare is narrowing the gap in health disparities, ensuring equitable care for all. It's navigating the social determinants of health, which really almost decide how someone's life may end up in terms of their health. It's striving for the best outcomes. It's advocating for those who may not have the voices to advocate for themselves. So and there may be different reasons for that. It could be literacy, it could be culture, it could be communication, it could be access, it could be economics, it could be navigating bias. And wow, that is a lot to overcome in 17 minutes. So it's important that we spend that time wisely. So I talked a lot about building relationships, and that takes listening. You really cannot build a relationship without listening. So it's listening to the individual patient, building trust, navigating the care journey together. At an institutional level, for those of us that work for institutions, it's understanding and listening, understanding the priorities, the perspectives, the missions of the institution so that you can best navigate through and advocate for your patients within these systems. It also takes listening to build teams. Recall that I said that we can't do this alone. Even if you are exceptional, we need to work as teams in healthcare. So even if you have the best ideas and the best intentions, you really need these teams. And so listening is really critical to understand the perspectives of others, to identify areas of common goals, shared mission, to build consensus, which is important, and then to tackle all the hard work that we do together. Active listening in the healthcare environment really shows respect for the patient. And we don't talk about that enough, but it shows respect for the patient's own knowledge of their healthcare and their healthcare journey. It shows respect for the patient's role in their own shared decision-making in their healthcare journey. And so listening is not something that you just learn to do, but we always strive to further develop and to refine and to hone the skill because we need it for the best outcomes in healthcare. So if we go back to the issue, if we don't have that entire 17 minutes, like I said, because listening is required, then how do you actually impact or stimulate change when you have such a short amount of time? How do you disrupt the status quo? Since in a lot of situations, we know that the status quo is actually not acceptable. Our outcomes show us that. So that leads me then to my next point that I want to share with you. And it's not embracing the status quo. So imagine if we all lived in a world where the rule was just to follow what has been done before, no matter what the outcome was, no matter what the risk was, no matter what the loss was, no matter what the consequence was. We would all say that's not acceptable, right? So one of the things that I've learned and I've kind of embraced is asking the whys. If you don't ask the whys, the why nots, the what ifs, then nothing really changes. And it's extremely hard to affect change if you don't understand why things are being done a certain way in the first place. I found that innovation in medicine and in business, most fields, really comes from wanting to affect change, but it also comes from a core dissatisfaction in the status quo, so wanting to do things differently. For myself, I joined my current organization in a time of tremendous turmoil in American healthcare and in modern history during the height of the COVID pandemic. I was tasked to build a new division, joining a new organization. It's such a tumultuous time, and there were a lot of challenges. And if you ask anyone who works with me, I asked why a lot. And then I listened. And then I asked why again. And then I listened and I learned at a deeper level. It's really important that we keep asking the why of what we're doing to get better at what we do to make progress. So I always ask, what did we learn? How did that go? What can we change? How can we do this better? How can we provide excellent healthcare to patients? How can we provide the most innovative care? How can we be inclusive? Because that's really important. And how can we take into account those who've been marginalized in healthcare and society? So really asking the whys. To me, it really all layers upon each other. You have to build the relationships with the patients, with the team, with the colleagues, with the mentors, with the stakeholders, with the other leaders to really build trust and to make a difference. But then you have to listen so you can identify areas where the status quo is just not okay, and then use those skills to start striving to make change. So the last thing I want to share with you that I thought was really important to me as I thought about this presentation was the ability to embrace change, to learn new things, and not to be fearful of the next step. And so I think in medicine, we are all lifelong learners, right? We pat ourselves on the back, we pride ourselves, we read medical journals, we go to conferences, we do CMEs, we do all of these things to stay up to date. And it's important. Reading is important. Education is important. If you ask my family, reading is actually one of my favorite things to do. But I have found that a lot of the learning that we need to do to be really successful and to move the needle in healthcare really is more practical. It's actually much more situational. It's the nuances, it's the unspoken language, it's the nonverbal communication. It's the feeling when you walk in the room with the patient, or it's the pulse of the institution or organization that you work for. So these things are important. It takes the EQ, it takes the softer skills, it takes adaptability to make progress. We've all been through difficult times, and we know that change is truly inevitable. Obviously, a great example of that is the COVID-19 pandemic. We know that the best made plans don't always work out, but innovation actually comes from these moments too. We saw that with the rapid rise of telemedicine, of remote patient monitoring, of new drug development, new vaccine development. In my own field, I have seen this with the rapid rise of immune therapeutics, which have truly changed the way that we treat patients. They have really impacted lives. When we think about these difficult times, I think they're important to learn from. So in my own situation, I've definitely experienced sharp turns that were unexpected and situations that I think in hindsight were actually very difficult when I look back. Earlier this academic year, I was at a forum and I was asked to talk about some of these challenges. And the one that came to mind for me was really early on in my career. So just shortly after where some of the medical students are today, where I had an unexpected change in plans, really a change in career path completely, due to an abrupt illness and a supervisor that I was going to spend a research year with. It didn't help that it was during a really difficult time in American history. I was living in New York City during the 9/11 attacks, and there was just a lot going on. It was a challenging year. And I was asked at this forum, well, how did you keep going or keep moving forward when these circumstances made it seem insurmountable? And I thought that was a really good question. I actually had to stop and pause and really think about that, because in all this time, I've never been asked that question. And so it caught me off guard. And my response really was, I actually never thought there was an option not to keep going. So I did. And this is, and from that, I think I've since learned that change is coming. Change is always going to come. The way that we adapt to it and make the most of it is actually key. It's one of the qualities that separates out the most effective leaders in healthcare. Some of our best innovation comes from struggle and from the need to change. And some of the most important change really comes from how we listen to our patients, creating new care paths for patient care and for research and discovery. But most importantly, it actually comes from building these positive relationships. To me, that might be the best way to affect change. It's by earning trust and showing compassion so that we all thrive together, because the healthcare landscape is ever changing. So I hope that in this short time, I was able to share a little bit of my outlook on leadership and innovation and service in healthcare, which I hope that you can take a little bit away from and you might find valuable in your own healthcare and professional development journeys. Thank you for allowing me your 17 minutes. I'm going to welcome Monica Robbins. She's the WKYC Channel 3 Senior Health Reporter. She's going to moderate the Q&A for this session. Thank you all.
Hi, everybody. How are you? And I just want to give a shout out to our virtual participants. So, I know graduation is on Saturday, I believe. So everyone in this room has to ask a question today. So, but I want to start with, the healthcare disparity and how to close the gap. And one of the things that Rainbow did was, and UH did, was open a facility in the underserved Midtown Cleveland. What, if anything, is being taught you about caring for disadvantaged communities? And this is a question from Rod, and I think this goes miles, because what are we learning? What are we seeing that we need?
Yes, that is a question. I could talk about that for a long time, but just to say, University Hospitals has really committed to addressing health disparities and opening this clinic in an area where we really needed the access for the patients was tremendous. In my own field, we see a lot of disparities. So I think the biggest example is asthma. We still have kids that die of asthma that shouldn't happen. And so, what we're learning, I think, is that we can do better jobs as individual providers, as healthcare systems, to bring access to patients who may not be able to get there for all of these reasons with social determinants of health. So it may be housing, it may be economics, it may be lots of different situations. And so kind of having point of care access is great. But I think it goes further than that. When we think about disparities, I think that everyone sort of sometimes feels helpless, as if it's something that needs to change for healthcare in general, but that the individual provider doesn't have a role in that. And I think we do. So I hope that people can feel empowered that you do. It starts with the way that you communicate with patients, right? I talked about that already, but communication is really important, especially to overcome health disparities. There's a lot of mistrust for a variety of reasons. And when you can make a connection with the patient and really show genuine interest that you are in it with them and you want them to get healthy, and you want them to stay healthy, I think that makes a difference. And every one person that you can make a difference with is important, and that sort of snowballs. And there's a perception that perhaps certain patient populations are not going to be compliant, or they're not going to care about what you're talking about. And I contend that there's nobody who wants to be unhealthy. There's absolutely nobody who wants to be unhealthy, right? So it's really, from an individual provider perspective, really figuring out what the needs are for your community, for the patients that you serve. Do you need interpreters? Do you need social services to have that time to build the trust and really talk through situations and healthcare choices? And then for institutions, really to prioritize it, I think is important. And there's so many ways to prioritize it, between access, between the way that research is presented to the community. So it's so layered, but I think everybody has a role, whether you think you do or not.
Do you think the pandemic actually increased the lack of trust in the healthcare community? And if so, how do you deal with that?
Yeah, that's a good question. In some ways, perhaps, but in other ways, I mean, I think that really people saw how important being healthy was, and having access to doctors, advanced care providers, nurses, because, we went through a bad time, and it's still a real issue for people. But it did raise questions on what we should do. It raised questions on autonomy, and so so I think that there were different layers of mistrust already in society, and those became a little broader. But I found, at least on a personal level, with my own patients and my own conversations, that's when it required me to step up as a provider, and to actually sit down and say, well, why are you feeling that way? What have you heard? What information can I give you? Can I share what I think about it? What my family thinks about it? What's our goal? And really talking through it. And sometimes it's not one conversation, but this is the beauty of healthcare, that you may have multiple touch points with the patient, with the family, where you're able to make an impression once you build that trust. And I found that, especially with some of the mistrusts that we saw with the pandemic, those relationships were really critical, and really actually made a difference in how the patient decided to proceed or move forward with their healthcare.
Communication, we know, is always key. And you're saying that you're bringing in personal aspects of your life. Is that okay for a physician to do?
Yeah, we're human. And it is okay, because your patients need to understand that you understand them. Right. At some level, we're all patients too, right? And your family members have maybe sat in that same position. And I think that it brings a little bit more relatability, a little bit more credibility to say that, yeah, I understand the medical aspect of it. But I understand the personal aspect of it too. And I understand how you feel, and I respect how you feel. So these are really important, I think.
I want to remind our live audience that there are microphones on either side. So if you have a question, don't hesitate. Please go up and I will call on you. And we have someone moving that way right now. All right. Well, we can sort of, so the question was, when you were dealing with what you were dealing in New York, you didn't know there was any other road to go. You just knew you didn't have really a choice. Talk about where in your head that came from, and how did you move past that?
Yeah. So I think that has to do with resilience, which I think is a quality or a trait that I learned here at NEOMED. And it's something that I learned at home. I learned from my parents. I really, and confidence. I, even in the beginning with your question about being a young or naive medical student and not knowing whether you could make a difference and just thinking you could, right? That came from having some confidence and maybe naivety, but not really doubting myself. I think that change happens, and in the moment, sometimes you can choose to say, well, I just can't do this, or you figure out what you can do and you you move forward. I think it was just really that. But I think with every decision we make, with every opportunity that comes, that you decide, right, you can go one path or go the other. It's really checking in and making sure that what that opportunity is resonates with you, resonates with your core values. You might not actually know what you're going to do yet. I'm always shocked when people have these very clear, defined life paths already when they're so young. But being able to know at least what your core values are helps to guide that path, and having confidence that you can do it helps to guide.
One of the other things you talked about is change is always going to come.
Yes.
Adaptability is key.
Yes.
How is that something that can be taught, or is that innate?
I think it can be taught. I think that it may take some patience, and it may take some self-checking in. And there are a lot of things that we do that we really have to be conscious of, and to step back and to think about, and the way that we react to situations. I think in general, right, we're in very high pressure, high intense careers. We take care of people who may not feel well, emotions may be charged, and really taking that time to step back, think about a situation, put yourself in someone else's shoes, and figure out what are the next best options. I think it can be taught, but it's just practice.
We have another question from our audience. Hopefully the microphone works. Let's see.
Is it working?
Yes.
Working.
Thank you so much for your words on relationship building and working as a team. A lot of the concepts that we're teaching to our students today. So thank you for that. My question is, this summer, we're going to have 3 of our NEOMED students working on a summer project, one of the summer research projects, on developing a video of creating a welcoming clinical environment for patients of Hispanic heritage.
Mhm.
And it's at least going to be a training video for one of our federally qualified health centers here. And I was wondering, because you talked so much about building relationships, what's one aspect that you definitely would want to have the students portray in this video? And keeping in mind, this video is going to be an illustration of a bad encounter and then how to make it much better.
That's wonderful, first of all. So congratulations on the project that the students are going to be doing. I think that's going to be so impactful. The one thing that I would say is that I talked a little bit about the nonverbal communication, the unspoken language, the feeling that we all have when you come in a room and when you don't. And I think that one of the things that the students could think about portraying really is their bedside manner, their nonverbal communication. They're having a welcoming body language actually is so important for a patient. It's the first 30 seconds when you walk in the room that really determines how that visit is going to go. And usually that first 30 seconds has nothing to do with what you say. It's not the first thing you say, it's the way that you enter a situation or environment. And so I would say that that was something that they could focus on for the positive example, really is their body language, their nonverbal communication as they enter. And maybe that's even more important because maybe there's a communication challenge in that particular situation that you're describing. So the nonverbal part of it is going to be so important. It can make or break that visit for the encounter. Yeah.
Can you talk about the importance of establishing national relationships to advance the work in our local communities as well as others?
Yes. So for me, one of the things that I've come to realize over my career that is important for me is making impact. And we think about the impact that we can make as individual providers, right? So I want to be able to make an impact and help someone, essentially. Most of us go into this field because you want to help, people. But I realize that there are a lot of systems in place that may make that individual point of contact a little bit more difficult or a little bit more challenging. And so it's really important to be able to have a voice at a higher level where some of the decisions are made so that you can really impact from a greater level. So for me, you have the individual one-on-one impact, but working with a lot of the national professional organizations or working with our American Board of Allergy and Immunology allows me to have impact on thousands of people. It's not just that one-to-one, it's how do we care for patients? How do we keep the public safe? How do we change problems that we see to make things better? So it really is having that seat at the table that I think is so important, and being involved with locally, regionally, nationally allows you to have some input and make some impact. So that's important.
Okay.
Sure. Yeah, so for medical students and trainees, really how to build the relationships and make the impact. So I think a lot of this is our mindset. It's medical school is hard. Residency is hard. You're tired. You're working a lot, but really it's the mindset, having an open mind to, first of all, working with different people, showing some enthusiasm. I think as humans, just as, social creatures, if you are excited or you show interest in what someone else is doing, they are equally excited. They give that right back to you. They're excited to teach you. They're excited to show you. And it may be something that you love. It may not be something that you love, but it just creates that relationship and it may open other doors. I found that you may create a bond with someone and they get to know you and they may say, well, if you don't like this, why don't you work with my other colleague here? It's just, it's dominoes, right? Once you can make yourself open and make yourself available. So really is the mindset of the student to make yourself available. I talked about before having these impactful teachers. I talked about my 4th grade teacher, my 10th grade teacher. My 10th grade math teacher was geometry. I actually hated geometry. So it wasn't even, something that I thought that I was going to like, and I still don't like geometry, but he was so enthusiastic. His motto was, a day without math is like a day without sunshine. So you just learned, and it's infectious. And then it wasn't that bad after that. And it really kind of opened my mind to say, well, even if I made my decision that might be not something that I want to do, I can learn it and I can take something away from it. And I think that especially medical school, you do all the different rotations. You should have an open mind. You should connect with people. You should show interest in what they're doing, and you'll get that right back, and that will blossom. So, yeah.
The burden of asthma in the United States falls disproportionately on Black, Hispanic, and American Indian, Alaska Native people. What needs to be done to bring positive change to this critical issue?
So I mentioned before that in my particularly field, allergy, immunology, asthma, health disparities are probably the most well-documented example of disparities, although we have disparities across the board. And I think it's layered. When we look at the data, patients with asthma who may be of those backgrounds that you mentioned may be less likely to be referred to specialists like myself in the first place. It may be an access issue, it may be an economic issue. A lot of it has to do with social determinants of health. May live in areas where you are exposed to your allergens on a very regular basis that could be driving some of your asthma exacerbations. A lot of it has to do with not having that time to get the education on really what to do. What inhaler should I be using? What medication should I be using? And I talked about these targeted immune therapeutics. Those truly have changed the landscape, especially in asthma, across a lot of our chronic diseases that we take care of, but you may never even get the opportunity to be offered newer innovative therapies because you don't ever cross the door of the specialist. So I think it's multi-layered, but it's A, recognizing the problem, B, then making sure that patients might get to see an allergist or pulmonologist or someone who may have that extra expertise in it. But then it's partially on the systems, healthcare systems, to say, okay, well, maybe we need some social interventions here. There may be some things that, I always think about people's circumstances, and especially our children. They're sometimes just born in a circumstance where they're going to be more exposed and they may have less access for so many different reasons. And so I think that on an individual basis, we can keep up with guidelines. We know that a lot of guideline care doesn't happen in asthma. Refer the patients, have those centers like we talked about earlier, where you may have point of access for some of the specialists. And then really for institutions to really think about what kind of services can we provide that might help decrease the ER visits, decrease exacerbations, decrease the ICU visits. And so it's layered, but I think this is an area that we can definitely make impact in.
One of the ideas for going after the social determinants of health is moving back toward house calls.
Yeah.
How do you think that is the answer, or is there just, like you said, it's much more layered? But would that be at least one critical aspect? Because then you can see where this child is living and what this child is dealing with.
So we did that actually, inadvertently, because of telemedicine with the pandemic. One of the things that I think really was eye-opening with telemedicine is all of a sudden, we talked about it for years and years. This is the wave of the future. We're going to do it. And then March 2020 comes and everyone was doing telemedicine, right? It was no longer something that it was possible that could happen. We were forced into being innovative and figuring out how you could get to patients. By doing that, we actually got into homes. So with telemedicine, it was instructive for me because I could see, just as I could see where you were, you could see where they were, and you could see some of the challenges that patients may have had. And so, to me, those were almost like virtual house calls, because you got to have a better understanding of, okay, this is why this might be difficult and what can we do about this?
So we have a question coming.
Good afternoon. Thank you for being here. I so appreciate you. And I'm just thinking as you're talking, I had asthma as a child, and it was really wild. We don't have enough time to talk about the story, but I didn't have the language, but I knew it was the house, right? I didn't have asthma. We moved into this home, and all of a sudden I had asthma. Now I understand, right? It was the house. It was the factory that was like right at the end of the street that we resided. So just as, I was hearing you talking about like disrupting the status quo, and many, when you think about healthcare systems, are literally right in the middle of under-resourced neighborhoods. And so while everyone's busy, but collectively, how can our physicians and other members of the interdisciplinary team come together and start pushing those institutions in regards to like engaging, the individuals like right outside their doors, and then also, supporting them, right? So we're talking about what do people need? Also, oftentimes people need a safe place they lay their head. They need adequate and, safe housing and transportation and all the things, so how can, thinking about how can we all come together to be able to start disrupting that status quo?
That's a great question. So, I think it's obviously it's complex, but it's something that we each can play a role in. So one of the other areas that we focus on in allergy is food allergy. Well, we think about this, it's common knowledge to everyone that a lot of kids have food allergy, but we don't think about the kids that live in food deserts. Food allergy is doubly challenging if you are food insecure and you live in a food desert and you just can't eat anything, right? Because you're allergic, you have a medical condition. And so, as an example, one of the things that we're focusing on right now is, okay, we've got point of care access in some under-resourced areas, but we have these medical issues that are still going to be, they're still going to be hard for patients. So we then as providers, as leadership, we talk about these things and say, well, how can we get programs together that we can get healthy food, safe food, especially to patients who may not be able to get those foods or may not be able to, or government programs are not necessarily taking into account their food allergies. And so that's a small example, but it's really us as providers identifying the problem, but not just identifying the issue and shrugging our shoulders and saying, oh, it stinks that it's this way, but actually saying, okay, well, what resources do we have at the institution, or who do we bring this to so that we might be able to create resources? Is it something that we need to raise funds around? Because I think in Northeast Ohio, we have a lot of people who care. If they know what the issues are, right? So do we raise funds around it? Do we identify what other social services that we may need to address some of these problems? So I think making sure that we're all taking an active role. I think it's very easy for us to say, well, I'm just coming to work today and going, but I wish these problems weren't here, rather than saying, I have a role in solving these problems and I have a voice that's going to be heard, maybe more than the patient that you're taking care of. And you can take that voice to organizations. And I found that, the organizations do care. If they know that it's an issue and it's impacting healthcare, and you can come with potential ideas and solutions. I think about one of the things that I thought was very cool that UH has done is there's a clinical trials research bus that goes out to different under-resourced areas and talks about clinical trials and makes these bonds, right? When we think about advancement in healthcare, a lot of it comes from the innovation and the newer technologies and newer medications. But when we look at who actually gets those newer medications in clinical trials, it's not diverse at all. And there are multiple reasons for that, but there are things that institutions can do. And I think that was a great example of one is going out and building trust with the community. There are lots more that I could talk about that I think are really important, because that's an area that I'm particularly interested in. It's diversity and the research that we do. But I think using your voice makes a difference because our voices can be heard, so we should use them.
I want to remind our virtual watchers and listeners to, if you have questions, please put them in the Q&A section. You were talking about allergies. So Rod wants to know, are there allergies unique to Northeast Ohio because of Lake Erie?
Well, so in the Great Lakes region, I think that the major allergens, the pollens that we see are pretty universal, but I will say that allergies have been increasing. And that has to do with a lot. It has to do with climate change. It has to do with the length of our pollen cycles, those sorts of things. So each region in the United States actually does have allergens that are different. If we think about Texas, they've got mountain cedar. We don't have that. But no, not just because of Lake Erie. I think it really kind of the whole Great Lakes region is pretty similar. Yeah.
Ohio has 4 of the top 25 children's hospitals in the country. Is it because Ohioans breed great pediatricians, or are the region's needs greater?
That's a good question. I don't know that I have the true answer for that, but I can say that as Ohioans, we're really lucky for the institutions that we have. We're lucky for this institution, and the amount of growth that has occurred here, even since I graduated, is amazing. I think we have a very vibrant medical community in Northeast Ohio, but in the state as a whole. So, and I think, I don't know, excellence breeds excellence. So maybe it's just that we've got, these great institutions and people want to stay.
Any idea how to, we have a lot of effort into STEM research and getting younger women into the medical field. There are programs already. I know Cleveland Clinic does one where they're going into high schools and finding young women who are interested in healthcare and then paying for their education if they want to go into nursing or anything else. What is the answer? What do we need to do? Is it the education system? How do we get younger people into the STEM fields, and especially women and women of color?
I think so. Cleveland Clinic has done a great job with that. UH has very similar programs too, and they have a health scholars program. I think it starts a lot earlier than where we start. So I'm going to take this back to my fourth grade teacher. I said I loved Mrs. Clark. The reason why is because she was just so straightforward and she built confidence. She just said, "You're smart and you can do this." I got that at home, but you don't always get that, in all the challenges that we have in early childhood education. And if we were able to make these impacts much earlier, because once you fall behind, you may never catch up to where you need to be to even be competitive for some of these slots. So really getting into the elementary schools, letting the kids know that these are options for you. I did it, you can do it, makes a big difference. And these are the things that you need to do. And then continuing to have those touch points, because it's hard by the time you graduate from high school and are thinking about college if you haven't really ever envisioned yourself in that career path to begin with. And I think really early on, if a child knows that this is something I can do, then, and these are the things that I might need to do to get there, having that possibility, I think for them, makes such a big difference. So it's super early, much earlier than we touch points usually.
I know these medical students are focused on getting out, getting into their careers, but looking behind and inspiring those coming up.
Yes.
Would you?
Yeah. It's a great thing for medical students to do. I think that the younger you are, the more relatable you might be to someone who says, I think I can do that too. But yeah, it's something that I think we all need to think about, and that investment in education needs to be so much earlier to get to have a more diverse workforce in healthcare.
We have just a few minutes left. I want to know, what is the one thing you wish you knew the day you graduated from NEOMED that you know now?
That's a good question. That, I'll get to where I need to be. And I don't know. I think that we're all very pressured to think, I must do this. I must, again, going back to those 5-year plans and those 10-year plans, and which I think are unrealistic for a lot of situations, maybe later on in your career. But having that pressure, I think when you are a medical student and you've got your USMLEs coming up and you've got your residency applications coming up, and there's always, am I going to score enough? Am I going to get higher? Am I going to get to this program that I want to be in? Am I going to get to this fellowship? And I guess trusting the process and doing my best, I think would be something. It would have taken away some of the stress, but some of that stress is actually helpful because it makes you do what you need to do in the first place. But trusting the process and knowing that I'll get to where I need to be. All right. Or it'll find me.
Doctor, thank you so much for your time. I will hand it back over to President.
Thank you, Monica, for your expert moderation. And Dr. Ogbogu, thank you so much for an engaging conversation. You certainly make us proud, and we know we're doing great things when we put out professionals and leaders like you out of this university. Ladies and gentlemen, we are taking a break until September. Please stay active, engaged, and well, and we look forward to seeing you back for VITALS in September of 2023.
This is VITALS, Visionary Health Leadership in Action.